with a local doctor is in for Everyday
Morning. Good to
Solutions.
see ya.
Okay, so Dr. Zunin, what is happening regarding workers' compensation and injured workers?
Well, workers' compensation it's a great system overall
Yes.
in Hawaii, and but it can be difficult to navigate.
Yes.
The biggest problem we see is that injured workers will tend to go back to their primary care docs who don't take care of occupational medicine. Or even the ER docs will take care in the ER and then send them back to the primaries, and then they say, well, we don't do that. So sometimes it can be 3-4 weeks before they get to us, and by that time, they've had a lot of pain, they haven't had treatment, and they're kind of upset. So it's a completely different set of insurance systems, different regulations. It's a specialty that needs to be learned.
Okay, so since COVID, the unemployment rate is, hovering around 3%. But you said that you're seeing more injured workers.
We are.
Yeah.
Hawaii is about 3%. The rest of the country is about 4% unemployment. So people are working, and we're seeing more injured workers because people are back.
Right.
And about 70% of it is musculoskeletal, so necks, backs. A lot of it is from people that are doing heavy work, lifting, in the unions, lifting, some falls, but also people sitting at the desks all day long. We're getting carpal tunnel syndrome and, neck and back from the inactivity.
Right.
And then there's maybe 10 or 15%, maybe eye injuries, skin irritation, and so on.
Okay, so what can people do to prevent this? As far as injuries and just all that, are there things that you're advising them to do?
Sure. Well, for prevention, we do go out to to unions, to large companies, and offer safety guidance.
Okay.
But a lot of the for the heavy lifting,
Yes.
it's how you lift.
Yes,
Use your
exactly.
knees. Don't load your spine and then twist, and then. When you're sitting in the office in a screen all the time, it's important that you have a back support, that the palms are raised a little bit to avoid carpal tunnel syndrome.
Okay.
And that the screen is high enough so that we don't have this neck injury.
And so, Doc, do you think that the worker compensation healthcare system, how is it working in Hawaii, and how is it doing?
Look, we've been doing it for 30 years, and it's far from perfect, but I really think it's one of the better systems in the country. It's certainly better than California and Washington. In the first 60 days, you have access to of course, medications and x-rays and so on, but also acupuncture, chiropractic, massage, physical therapy, a lot of services that you wouldn't normally get under a general health insurance policy.
Okay, thank you so much, Dr. Zunin. And we'll have all this information online.